Hi, my name is Rachel Lytle. I'm a nursing student at the Florida State College of Jacksonville, and I am doing a group presentation with my team members James Beck and Tiffany Blanton on the induction of hypothermia after cardiac arrest. My portion will include the pathophysiology of cardiac arrest and also hypothermia. And I'll also talk about treatment and signs and symptoms. So cardiac arrest is a medical emergency. It occurs after an abrupt, unexpected loss of heart function, breathing, or consciousness. So a lot of times cardiac arrest happens when a patient sustains ventricular fibrillation or ventricular tachycardia. Their heart's just pumping, but it's not pumping effectively, and that is, again, a medical emergency. Hope you can see this. So, signs and symptoms of cardiac arrest is sudden loss of responsiveness and or just loss of consciousness altogether and unable to be aroused. Treatment is, again, it's a medical emergency, so you want to call for help, call 911, activate an AED, and really begin CPR right away. Hypothermia can be a medical emergency, definitely not as fast as your cardiac arrest, but it definitely is something that has to be treated. So hypothermia happens when the core body temperature declines and the basal metabolic rate and oxygen consumption decreases. So the primary loss of heat in our body happens out of our skin. It's about 90% of the time, and our lungs about 10% of the time. And there's a lot of changes that occur cardiac-wise, but what happens is when temperature declines, our heart, our cardiovascular system leads to an Osborne J wave, which is a positive deflection that occurs at the junction between the QRS complex and the ST segment, where the S point, also known as the J point, normally occurs. So you also will see a decreased central nervous system activity for patients or a person who has gone into hypothermia. You just know when you're cold, things move a lot slower or depressed because you're kind of freezing. So that's something to think about. Signs and symptoms and treatment of hypothermia. So signs and symptoms of mild hypothermia, and this is really temperature in Celsius, so you can do your calculations. 34 to less than 36 degrees Celsius is mild hypothermia. Shivering, you'll start to see loss of fine motor conduction, lethargy, so fatigue, and mild confusion. Moderate hypothermia is about 34 to 35 degrees Celsius, and severe is going to be less than 30 degrees Celsius. There's going to be a possible pupil dilation, cardiovascular activity ceases, so you might see patients with cardiac arrest. So it's definitely something you have to be aware of and respond to immediately. Of course, you're going to see the shivering, the loss of fine motor, along with those, and very fatigue, lethargy, and confusion. Treatment prior to getting a patient to the hospital is CPR should be initiated for patients that do experience the sudden cardiac arrest. That has to be your priority. And then hospital treatment, of course, is going to be core temperature. You're going to want to regain the temperature on that patient, and really slowly. So the literature says putting a patient in more of a horizontal position, cardiac monitoring, rapid core rewarming. And I thought this was really interesting because you want to establish a IV immediately, with heated IV solutions. So that's definitely a way to not shock the body, but slowly bring it back to temperature. Administer warm humidifier or humidified air via oxygen, and that's going to be heated to about 42 to 46 degrees Celsius. Venous catheter created create a circulatory fistula through which the blood is heated and monitored. So just a lot of these interventions are very quick and responsive, but they're definitely not going to be something that you're going to try to shock the body or shock the patient back into warming them, okay? So something to think about. My colleagues or my partners will then go into their portion of this group presentation, but that is my part. I hope I answered any questions you might have.